Welcome back, everybody, to Beauty and the BS. I'm really excited about our show today because this is a topic that so many people are interested in and so many people are uncomfortable talking about. But it is a topic that has grown over the years to the point where it really bears more discussion. If you were with us last year, we talked a lot about vaginal beautification. And I want to alter that a little bit this year in talking about not just the procedures, but the social implications of modifying the genitalia. So with us today is Dr. Gemma Sharp. Dr. Sharp leads the Body Image and Eating Disorder Research Group in the Department of Neuroscience at Monash University. She holds a number of degrees. She has a Bachelor of Science in Molecular Biology, a Bachelor of Science honors degree in microbiology and immunology, a master's degree in oncology, a PhD in clinical psychology. She's got research in Australia, in Japan, in the UK. She was awarded, as I mentioned, a PhD from Flinders University in Adelaide in 2017. And there she investigated the psychological predictors and outcomes of female genital body image concerns and cosmetic surgery. And she continues this genital self-image research across the spectrum of gender. She's been named the Australian Broadcasting Company's Radio National Top 5 Under 40 Scientists, among many of the other accomplishments. In addition to all of that, she's a registered clinical psychologist and has led clinical experience in the public and private sectors in Adelaide, Perth, and Melbourne, Australia. And she really is at the forefront of the concept of the psychology of accepting body habitus as it is. Her mission has become to break down those social taboos around perfectly normal body parts, and she plans on slowly chipping away at these issues in her research and her clinical practice. We have, in addition, someone who I have been a big fan of for a long time, and unbeknownst to her, a student of hers for a long time as well. Dr. Christine Hamori is a board-certified plastic surgeon who is recognized for her clinical expertise in female genital aesthetic surgery, as well as non-surgical vaginal rejuvenation treatments, among the many other things that she does as a plastic surgeon, which we could go into many other podcasts going over to her areas of expertise. She practices in Duxbury, Massachusetts, yet Dr. Hamori's wide reputation in labial surgery brings patients from all over the world to the Boston area where she practices. She's a leader in the field of female genital surgery. She speaks, writes, and teaches on labiaplasty and related topics. And Dr. Hamori advocates for women's health and wellness, adopting non-surgical technologies as well as appropriately addressing patient complaints and with the goal of increasing their self-confidence. Dr. Hamori, Dr. Sharp, thank you so much for joining me today.
Thank you for having us.
Well, this is an interesting topic because when I decided to have this podcast, I wanted to have kind of the old-fashioned point-counterpoint where someone was going to get into a kind of a rough-and-tumble argument with the other, some having an anti-genital modification argument and some having a absolute pro. I'm not sure I'm going to have that in this discussion, but I think we're going to get different perspectives. So I want to just jump into this right now because oftentimes I will use, and other people will use the term vaginal beautification. And I think this is really a misnomer, especially when we're using the term vaginal, because it's remarkable how, to so many, this tremendously important part of the body remains a mystery. Dr. Hamori, in order to really understand female genital modification, we probably need a basic anatomy lesson. Can you help us out a little bit with that?
Yes, definitely, because the terminology is a little bit confusing, especially to the lay person and sometimes to surgeons and plastic surgeons, psychologists, anyone. So basically, I like to refer from externally to internally. So externally, we have the vulva, which we have the labia majora, which surround the inner lips of labia minora. And the clitoral hood is covered by, the clitoris itself is covered by a hood. There's the mons pubis that projects towards anteriorly. And then you have, as you go more internally, you have the introitus or the vaginal opening, and then you have the vagina itself. And amongst their kind of spreading the top over the top of the vaginal wall more deeply would be the whole clitoral body, the crura, and the whole urethral clitoral mechanism, which is under there. But mostly we talk about externally, the vulva,
and
then
I think
the vagina.
that in general, the public and physicians as well will just call it the vagina, and I think that's really not an accurate term. So I'm hoping that we can kind of, start to dispel that terminology. And really, would you say that vulva modification is probably the proper term for this with regard to the visual aspect from the external standpoint?
Maybe, yeah, vulvar restoration. We're not necessarily modifying to make the area look necessarily different. We want it to look better or restore it to how it once was. But I don't like to think of changing the vulva to look like a pornographic vulva. We're not really trying to do that. We're trying to just make it the
when
best vulva.
When we talk about vulva restoration, most people have in their mind labiaplasty. What do you think what's most commonly referred to when we're talking about labiaplasty?
Reduction of the protrusion of the labia minora beyond the majora. So women feel that there's too much inner labia showing. No one has pubic hair anymore, and it makes them feel that they're less confident, nude in the bedroom. And this is just some women, it's not all women. And sometimes when they're wearing yoga pants, for whatever reason, the inseam is short and they're uncomfortable about the appearance of that area. But it's not everyone. It's very interesting because I actually did surgery on a lady today and did some inner thigh liposuction. You'd appreciate that, Peter. And she did not come to me about labia. And this lady had much larger labia than any of my other very many labiaplasty patients. And my scrub tech and it was interesting. She just wasn't bothered by it. She had a little fat in her inner thigh and that's all she wanted treated. And that's how it is. Some people just aren't aware of that area having any kind of impact on their self-esteem or their clothing choice. But some people do.
Dr. Sharp, over the years, at least in my adulthood, female grooming has changed dramatically from almost no grooming to to a little bit of a trim and then to almost nothing as far as pubic hair. And that trend probably has led to more notice of the external anatomy of the genitalia. You combine that with fashion changes, particularly as Dr. Hamori said, yoga pants and workout clothes, which are more tight-fitting. And the visualization of the genitalia is much more obvious now. And I think as a result of that, we've seen a shift in the desire to have surgery here long before social media came into play, but certainly social media, which we'll talk about, has a role in this. Now, you're an extremely educated individual, as we talked about, and so when you raise concern about this topic, it bears listening to. But as a plastic surgeon, my bias has always been towards the positives of this procedure and what it has on women. Tell me why I might be a little short-sighted on that.
What a loaded question. Thank you, Dr. Grossman. I want to also apologize to your listeners for the most boring biography they've probably ever heard. Thank you, Dr. Hamori. Yeah, I mean, so many points in that question, aren't there? I mean, you were talking about the changes in pubic hair removal, and I just wanted to say I actually think pubic hair is going to come back in. I think, like all beauty trends, like bigger lips are going out, smaller lips are coming back in. I do think there will be a change, but you're absolutely right that without the visibility of the genitalia, I don't think we would necessarily have the big uptick in labiaplasty surgery that we've seen. Certainly that's come through in my research. I don't necessarily think plastic surgeons have any kind of incorrect view. I think what all health professionals have in common is that they want to make their patient feel better, whether it's psychologically or physically. And I think if someone is coming into Dr. Hamori's office, for example, saying, I have these large labia minora that are making my life incredibly uncomfortable, both physically and psychologically, then why wouldn't Dr. Hamori offer surgery if she thought that this person was going to benefit? I think what the perspective I take is that, and we see this with body size in general, is that when only one type of genital appearance or one type of bodily appearance is portrayed, it makes people feel like they don't fit in. So if we can at least show some diversity in genital appearance and people still want to have surgery, that's absolutely fine. It's just that with genital depictions being so limited, particularly to pornographic materials, it's really challenging to reassure anyone that their genital appearance is okay. And I love that story Dr. Hamori gave about the liposuction patient. I think, good on you, that's great. If only she felt the same about her thighs, but nonetheless. Exactly. But I think it's about just challenging what the ideal is. And then if people still want to have surgery, I hope they would come to wonderful doctors like yourselves and get it done really, really well.
So for the most part, and there obviously we're going to talk about some of the variants, what we're hoping for as surgeons, as healthcare practitioners, is to have people feel better about themselves and get a better sense of self-esteem. My question to you is, do patients who get this operation have a better sense of self-esteem, and how do we know that for a fact, or how do we not know that for a fact?
That one's to me, Dr. Grossman.
That's going to be to both of you, but first one's to you.
Oh,
sure.
Okay. Yeah, that's been the subject of my research for 10 years now. How exciting! I should throw a party. So I think some patients will absolutely feel better, and others won't. And I think where the research kind of fails is that we can't always predict who is going to benefit and who won't from preoperative characteristics, and that's something that we really need to do a lot more research on. I think some people will say, yes, it's changed my life, and others will say, you know what, I feel better about the appearance, but there's some psychosexual issues that still remain. For example, I still feel uncomfortable with my partner giving me oral sex. I thought I would feel completely uninhibited in it, but I still do. And I think it goes to show that maybe surgery is part of the solution, and then potentially mental health work after that, or in conjunction with. So I think we can absolutely get to where the patient wants to go, and maybe it's an extension, a more multidisciplinary team to help the patient get there.
Dr. Hamori, in your practice, you felt that your patients had developed a greater sense of self-esteem, of self-image after the procedure?
Most of them have. So I've been doing that for probably about 27 years. So I learned along the way. What Gemma's saying is who to ask the questions of and try to find out what their psychosocial situation is, especially in some of your younger patients that aren't even sexually active. They're very fearful, they're anxious. you have to tread very lightly and go slowly, and I do, Gemma, show them lots
Absolutely.
of normal anatomy and more trim anatomy, and try to really dive down into a little bit about their, maybe give a body dysmorphic disorder questionnaire to them, because the people that I can remember, the couple that have kind of not felt better after the surgery, the warning signs were there beforehand, and I should have noticed them. And now I'm more sensitive, and now I know, and Gemma's taught me we have to give them questionnaires. All the patients are filling
We'll
out
have to try and
different types of
streamline that.
questionnaires, and through that I can kind of piece together. We're trying to get the vaginal cure at something, but or labia cure together, so there'd be fewer questions. But you just have to find out what the situation is for their self-confidence, and how what they perceive would be a good result, and how that's going to help them. And if there's any suspicious answers there, I try to question, and I have sent them to psychiatrists, and I have said no, which is now in the sense
Of
this age
course.
social media, they
Yeah.
get very angry and they write bad things, but I just want them to be happy and do a safe surgery. But I basically, through my experience, I've learned little red flags, what to worry about, but by far the majority of people are extremely happy. They're like breast reduction patients. They're the kind that come in after 2 months and they're like hugging you because you changed their lives and they feel so good. So that makes me feel good as a plastic surgeon, but you have to think about it, really weave through some things.
Yeah.
There
Do you
are-
mind if I? Oh, sorry. Do you
Please.
mind if I jump in there? Sorry, Dr. Grossman. I think you make such a good analogy there with breast reduction, Dr. Hamori, because I think these are both surgeries that involve the removal of something that's bothering a patient, to put it very rudimentarily. And I think that is where we do find the best outcomes, as opposed to, say, a rhinoplasty, which has, I think, a bit more subjectivity to the outcomes. Certainly, if we're looking at body dysmorphic disorder, we can see that people are more likely to be dissatisfied with those kind of, more subjective type surgeries, as opposed to, yay, my labia minora is reduced in size, I'm feeling a lot better.
Well, along those lines, you have here a procedure that has both a cosmetic aspect as well as a functional aspect, similar to breast reduction, which isn't just the aesthetics of a smaller, more uplifted breast, but the less weight and the better functionality. And regardless of the subjectivity of rhinoplasty also can have a functional aspect of it. So, Dr. Hamori, tell us, I'm sure that many people come to you for the aesthetics, but what are the functional reasons why someone would come for this procedure? Let's talk about labia minora reduction.
Probably the number one is that they feel rubbing. So the younger athletic girls, when they're wearing these yoga pants and doing classes and walking or wearing jeans, feel the sensation of rubbing. They have more of an awareness of the labia compared to people that don't probably come in. They also can have difficulty with intercourse. They can have invagination of the labia if they're large, and they describe some pinching sometimes. They can have a lot of swelling after intercourse is another complaint. And they feel embarrassed. There's a lot of embarrassment. I know that's not that functional, but it affects their sexual function because they don't want to be seen nude, and they're self-conscious if their significant other looks at that area. The lights have to be dim, so it does affect them that way as well.
If someone presented to you with that and say, these are things that bothered me, would you try to persuade them to think of non-surgical ways of emotionally dealing with that?
Do you know what I was thinking as Dr. Hamori was speaking? I was like, why don't we get yoga pants designers to change their design? Like, why are we asking the women to change? Sorry, I suppose I took a broader societal view. And I know, I'm sure you've seen this as well, Dr. Hamori, cycling and horseback riding are other issues. Yeah, and I'm like, why don't we get more comfortable bicycle seats? Instead of making women sit on like men's types of seats. But these are bigger issues that I have not yet found a solution for in 10 years, so I apologize to everyone listening. I think, Dr. Grossman, I wouldn't necessarily dissuade someone. And I think by the time they're seeing someone like Dr. Hamori, their minds are pretty much made up. You would find it very hard to dissuade anyone from not going down surgery pathway. And I think even if Dr. Hamori said, I don't want to do this procedure, as she was saying, they may unfortunately take to social media and say, Dr. Hamori wouldn't let me have my surgery, and they would go to someone else. I think probably the work that I do is more with really young girls when they're just developing that sense of genital self-image or genital body image, and going, okay, let's do our diversity education. Let's make sure that they try and think of their genitals in a positive way. So I don't think I would have much success with dissuading, and maybe nor should I. Maybe they're exactly the right candidate for surgery anyway, and maybe I help support them afterwards with a couple of sessions just to make sure that they come out of the procedure okay.
So let's...
I agree. The young girls have trouble when I got
Yeah.
like some 14-year-old or 17-year-old.
Yes.
And usually they have asymmetry, so one side's grown and has it, so they have their own internal control, and they're like
Yes,
they
exactly.
the one that's growing, even though it's the normal one, the other one's actually
Yes.
not growing. So you have to educate
Absolutely.
them. It's difficult. So I see that mostly with asymmetry. But the younger patients, we try to, like, especially if both sides are not that big and they're
Yes.
coming in at like 16 or 17, that's the tough one, because I'm like, they look normal. I think we should wait a couple of years and see if this still bothers you. But in my experience, this is within the normal range.
I agree, and that's
the
when,
difficult patient.
body image concerns tend to be so strong, like, not just with labia, but entire bodies, and it's very hard to be reassuring at those times. I don't envy you there, Dr. Hamori. It sounds like we're doing very similar work.
So we can all agree that there are patients who would significantly benefit from this, from a athletic standpoint, from a sexual standpoint, from a self-confidence standpoint. But we can't look at this anymore in a vacuum. We have to look at how society has come to play here, and how social media has come to play, and how distribution of photographs now that are all on everybody's phone comes to play. So, Dr. Sharp, I've heard you talk about some of the trauma that even very young girls have, to have as you put it, a designer vagina, converting an outie to an innie. Tell me your concerns about the societal effect on women with having this procedure, and the pressures that they may go, and how that affects them overall.
The pressure to be beautiful on women, I think that is an entirely different podcast, but I will be brief. I think, I suppose social media has meant that now we're more a part of media consumption, actively rather than passively, like, say, watching movies, watching TV shows. Now we're posting our own images on social media, following our favorite influencers, etc. So I think there is even more pressure to look a certain way, and at a younger age as well. Like, I just find I'll talk to these teenagers who want to look 25 and they're like 13. So I feel like there's been an acceleration of aesthetic development which doesn't necessarily match mental development. So that's a bit of an issue. And I think, I suppose just from a social perspective, like I'm always very keen when we have these genital diversity discussions that we don't just sort of talk to women about women's genitals, because it is comments from sexual partners, from siblings, from parents that sometimes instigate these concerns. So why are we just educating women? I mean, obviously I try to educate everyone, but I would also want the same for men and people who are gender diverse to feel similarly comfortable with their own genitalia and appreciate the diversity. And I think that's where social media can actually be a really positive thing. And what we found through my group's research is that we can actually put our interventions on social media and have really positive effects. So I don't think it's all bad news from social media. I think you can absolutely promote positive body image messages.
I was reading an article recently by a Dr. Logie Thomas, a gynecologist and a journalist also, and she had a pretty negative feeling on the idea of labiaplasty and rejuvenative or modification surgeries to the genitalia. She said that one of the things she said was that there's an unrealistic ideals due to the media, that several social researchers have related it to the preceding surge in widespread viewing of pornographic videos and movies by both males and females from childhood onwards, which has aroused a misleading and often rigid perspective on what the normal labia should look like. And thus the demand for labiaplasty is usually based in the first part on an unrealistic idea of what is normal, both on the part of the patient coming to see the doctor and the doctor who performs the surgery. Would you agree with that?
I think there are parts that I do agree with for sure. I will say though that pornography's been around forever since, in different forms. Accessibility of it has increased, and I suppose, I'm not someone to necessarily blame pornography. I think pornography is a reflection of society, maybe just an enhanced version. And I know we were talking about pubic hair removal earlier, and my understanding is that the reason we started removing pubic hair was just to get better camera shots in porn movies. So, anyway, I think... Well, it speaks to, I think the pornography industry could definitely create more ethical and diverse pornography, and I've seen a bit of a shift towards that, in fact. But there still exists the really unhelpful stuff as well, and kids are getting access to this at increasingly younger ages. I think in Australia, it's ages 7 or 8. I think that boys are getting their first taste of this kind of content. So I don't believe in blocking any of that kind of content, but I do believe in having a conversation, whether it's the parent, the educator, whoever, the trusted adult, before this kind of content is accessed. I think it's about putting it in context for young people, and then you can of course have those beauty ideals conversations. Like, the men in pornography, their penises are much larger than in normal life. They're chosen because of that. It's like the Olympics of penises, basically. Sorry for that. I don't know why I said that.
Thank God.
There goes my job at Monash. Anyway, so I think it's all part of how this stuff is phrased to young people, and this was mentioned earlier. It's basically just we pretend that young people aren't sexual until 18. Like it's just not true, and the way we speak needs to be age appropriate for the child's developmental age. But I think we're delaying conversations way too long.
So do you see a solution for that? Or what would your solution be for young children, teenagers who seem to be falling under that pressure?
I don't mean to say teens are past it, because they're definitely not, but I do think the best outcomes I've seen in my research are where the parents have had that ongoing conversation from the little one being sort of 3 or 4 years old when they first notice that they have genitalia, really, and giving the proper terms, as Dr. Hamori was saying. Like I've been lucky to speak to little girls who know the term vulva, and it just makes my heart sing that their parents have done that, because. And more broadly speaking, that child is actually at less risk of being sexually assaulted, because they know that part is special. They know how to name it if someone's going near it inappropriately. It is absolutely protective.
Dr. Hamori, we talked a little bit here about the effect that social media has on young girls and their development, their psychological development. But in your clinical practice, who is your average female to come and ask for a labiaplasty? And what age are they, and what stage of their life are they? Or is there an average that you see?
There's a couple peaks. So I'd say probably the first peak that you see, not these adolescents, but maybe the 23-year-old, 24-year-old hairdresser, maybe nurse, that's kind of between relationships, who wants to get, just for some reason has been thinking about this since adolescence. And there's usually something like Gemma said, a partner has made a comment, or someone in the locker room said something when they were in 7th grade, changing in the locker. Oh, did you see hers? And there's something seeds in their brain. So that's like one of the most common ones, would be that age. And then there's this whole other group, of women returning back in the dating scene, back in their late 30s, 40s, 50s, who've been divorced, had children, and now they're feeling that they have to look a little bit more up to date in that area. And yes, childbirth can affect the appearance, but also the trends have changed, everything's more visible, and then no more pubic hair. So that's another kind of hump, or another data point where I have more patients in that age group. So usually the 20s, and then perimenopausal later type patients coming in for
not
labiaplasty.
To badger Dr. Thomas's comments, but I'm going to bring, because I don't think she's isolated, but she said this, she said that labiaplasty has very few true medical indications, even though it's a surgical procedure. This raises the question as to whether cosmetic labial surgery ought to be classified as female genital mutilation. So, Christine, what are your thoughts on that?
Yeah, I agree.
That conversation's been going on a long time. And it's very hard to explain to people that do not have enlarged labia minora what it would be like to live with large labia minora. They do not understand it. I'll have some parents come in with the daughters, and they've never seen the daughter labia before, and once they see it, whether with the patient or in a photo, they're like, oh my God, I get it. I know why she wants to have this done. She doesn't look like me. I'm quote normal. So I personally don't think it's mutilation. I think it's trying, as much as breast augmentation or breast reduction would be mutilating the breast, I think you're trying to create a more comfortable physical situation for the patient. But they need to be educated about it. They need to make choices themselves and understand the risks.
I agree with Dr. Hamori that this conversation has been going on for 15 years at least, isn't it? And I almost think it's a disservice to people who are undergoing female genital mutilation. I mean, that's just a disgusting practice. Labiaplasty honestly could not be further from it, in my opinion, in that these people are making an informed decision, supported by hopefully those around them. They're not necessarily losing function of their genitalia. Like I feel like female genital mutilation is about decreasing sexual satisfaction, whereas these people want to increase their sexual satisfaction, generally speaking. Mutilation is just not correct. And I liked how Dr. Hamori said people don't understand unless they've walked in that person's shoes. And I mean, obviously in my clinical practice, empathy is something I'm always trying to help foster. And I just go, what's the part of your body that you don't like? Like, everyone has some bit that they would rather have changed, and most people don't have surgery, and okay, but all of us walk around with something we don't like about ourselves.
Do you feel then, because obviously you have reservations about the pressures put on society for this procedures. Do you have feelings that this procedure is influenced by a patriarchal society? Because other than circumcision, we don't have the same pressures on beautification of the penis or scrotum.
I am seeing things like scrotox and things come through, so I do think there's... Oh, the patriarchy discussion. Thank you for raising it. Wow. I can't wait for all the hate to come my way.
Just to let you know, we have an upcoming episode with the Dick Doc on TikTok, so we are going to have equal...
Fantastic.
Genitalia episodes here. But
I've got to get a new name. The Dick Doc on TikTok. I'm going to brand myself as something differently. I do actually have a radio name, Dr. G Spot. A shout out to all the radiotherapy listeners out there. I think it would be remiss of us not to at least acknowledge the influence of patriarchy in some of these decisions, and I think women are by far the larger consumers of all cosmetic procedures, and I think women tend to be valued for their beauty, and I think that has evolutionary underpinnings, that beauty was an indicator of health and fertility. So I don't think this is all within conscious awareness. I do think there are sort of primitive parts of the brain that are driving some of this. But I actually do have hope for the future in this respect, and I think we are seeing more women be financially independent, have their own careers. Dr. Hamori is a great example of succeeding in a more male-dominated field. So I do think there will be shifts. I think women will push back and go, no, I am more than my appearance. And I think the Gen Zs and younger that I am seeing are having more of that kind of conversation.
Dr. Hamori, when I look at this as a plastic surgeon, this particular procedure, I look at it very similarly to almost everything else we do in the aesthetic world. If really, there is not a norm. We're not saying something is normal, but we're trying to get somebody to a place where they have a sense of happiness. Now, we all advise our patients that surgery is not going to create happiness, and you have to do a deeper dive into the psychology of the patient. But we also know that there are some things that if we could change a little bit, it would make us feel better. And I think most people handle that in a mature way and not an unrealistic way. So do you see this procedure as any different than a rhinoplasty or a facelift or a breast reduction or an abdominoplasty? And if you don't, then, are you concerned that people like Dr. Sharp may be overstating the concern for this procedure? I'm trying to get some controversy here, guys.
I know, pitting us against each other. Jeez.
I know. How can you do that? No. I do consider it like the other kind of procedures. I do. But there is definitely, I do think there's more social pressure for the appearance of this area based on maybe pornography or the media, or like we were saying, the Lululemon pants not fitting right because the inseam's too short. Like, this just seems like almost just an easy solution for that. And there are other issues that maybe could be corrected. It is different a little bit. I have that feeling when I have the schedule, and there's like labiaplasty, then they're on the consult schedule, and the abdominoplasty, all these other things there. we don't send questionnaires to those other people. We don't deep dive into why they're getting the tummy tuck. We have to somehow, but we feel obliged to do that for the labia, because are we worried that maybe they don't really need the surgery, or do they have a sexual issue that they're getting the surgery to kind of try to improve that we can't? So there is a difference, but for me, I don't feel differently about doing that surgery and the reason for doing it.
So I have heard you speak and say that many of your patients are seeing you, your labiaplasty patients, are seeing you because of appearance, but because they may feel guilty of being self-conscious about their appearance, that they'll claim that they're wanting it because of irritation. Does this kind of validate to you some of Dr. Sharp's concerns about the social pressure? Or conversely, is this like other mixed functional and cosmetic procedures like rhinoplasty or breast reduction, where the stated reason versus the actual reasons may not always be so clear, and that there can be a mixture of both?
I think it's a mixture in the patients. Very few come in and say it's purely aesthetic, because if they're large enough to cause, in most patients, an aesthetic concern, it's usually deviating the urinary stream, or they're riding the Peloton, it gets raw. But I do think they tend to mention both things. There's a couple people that won't mention the aesthetic, they push it purely toward functional. And those are the ones that, like, they're big. Or they don't bother me, they look kids because they rub. I'm like, okay. So it's kind of reversed.
Dr. Sharp, when you look at the demographics of this procedure, is it in all countries? Is there certain countries where it's more prominent than others? What has your research shown?
Yeah, I mean, I think the genital aesthetic for women can differ quite radically by country, and we see this for other body parts as well. But I find it so fascinating with the genitalia. Like in some African places, a larger labia minora is considered the beauty standard, and I believe in Japan they like a butterfly-shaped labia minora. Isn't that nice? So I suppose I think. We, as different ethnic groups, we have always had some different, I suppose, beauty standards. But I think what we are seeing is, with social media, a bit of homogeneity in beauty standards, a bit of a coming together of the Insta face. These kinds of things, because, it's almost a bit of an ethnic blinding coming along. I'm thinking you may have seen this in your own practices. So I think those borders are being broken down, and we might end up with some beauty ideals which are standard across the globe, but right now there are still differences.
Do you, in your practice, are you equally focused on male and female body dysmorphia, or is it predominantly female?
Do you know, I would love to see more males come through my practice, Dr. Grossman. That would be great, because our statistics suggest that body dysmorphic disorder is experienced equally across the genders. So I think what's happening is that, particularly with BDD in men, it tends to be focused on a couple of discrete areas, whereas for women it seems to be a bit more diverse. So with men, I should say, it seems to be hair loss. So they might be going to the dermatologists, those kinds of people, getting those kinds of treatments, and penis size. So they're the people they're the males I would say. So I mean, I think I wouldn't be out of the realms by saying that women tend to seek healthcare more than men for any issue, and I think this is another area or another example of that.
Yeah, I think that there's a penile dysmorphophobia disorder that men have, that that they think that their penis is smaller than everybody else's, even though it may be normal. So I was wondering if there is a similar correlation, and maybe there's just that typical male, and I hate to generalize, but typical male suppression of some of their concerns, rather than I think a female population is a little bit more willing to address some of the emotional issues that they have.
I think so, and I mean, it's so. I always find it quite interesting when I talk about men's genital dissatisfaction versus women's. So when we talk about women's, we tend to be more concerned, more alarmist, more wanting to protect them. With men, we sort of go, "Can you get over it?" Or it's a bit of a joke. And I wish we had the same empathy for men that we did for other genders, because I think that might make them more receptive to seeking support from whoever it is. Like I can't tell you the number of laughs I get when I talk about penile dysmorphic disorder, and I just, it breaks my heart, because I speak with these guys and I know how crippling this is to them, and particularly that sense of identity that is so tied in with penis size, at least the men I speak with. And wouldn't that just be, that would be terrible. I couldn't imagine that as a woman. I mean, obviously I understand as much as I can, but to have my sense of identity tied up into a body part that I think is just not the right size is not great, and I wish more of them would come forward, because I do think we can help.
Dr. Hamori, in your practice, is there cultural distinctions between who are more interested or who are not, or is it just simply that you're going to attract the geographic area to where you are? And the reason I bring up this cultural issue is, in men, obviously, when it comes to circumcision, there is a cultural determination on that procedure, but also a geographic determination on that procedure. You'll find it still, I think, very prominent in the United States, and I assume that's sharp in Australia. It's not as common. In England, it's not as common. In more Middle Eastern countries, it probably is more common. So with vulva surgery, do you find that it's cultural at all, or do you find it just goes over all areas?
I think it goes over all areas. I mean, I see people, only if you start talking about hymenoplasty or some of these more different kind of procedures where you're kind of, that would be toward Middle Eastern people that I'd see that. But in general, I mean, I see just as many people in all different ethnic categories interested in that.
We focused a lot on labia minora reduction, but one of the things when we're talking about surgeries around the vulval area is those that are utilized to enhance sexual function. And while labiaplasty and reduction of the minora might do that, the other thing is surgeries around the clitoral hood. Is that something that you find is in demand right now? Are people comfortable coming to you and saying, "Hey, I just don't feel sexually aroused and I want to have something to feel better"? Is that an option for people, and has that been shown to be effective for enhancing sexual pleasure?
From the studies that I think I've done and seen through Gemma, most people have improved sexual function because they feel more self-confident, feel better about themselves. I don't know if there's been a study about direct clitoral hood reduction, increased sensation, necessarily, even though there's that perception there, because patients come in asking about that I've heard that if I have a clitoral hood reduction, it's going to be easier to have orgasm, and it's going to be easier to become aroused, which I haven't found, and I don't promise to people. I mean, it depends if they have an orgasmic disorder. There's so many other issues that are caught up in there, but besides their hood causing the issue. I mean, if they have a very bulky hood and they're looking in the mirror and they're very upset with how it looks and they barely can feel their clitoris, that's one issue. But in general, making a normal hood a little shorter is not going to, in my hands, improve sexual function. I wouldn't promise that.
Do you mind if I jump in here, Dr. Grossman? Such a good point you raised there, Dr. Hamori, and I was just thinking that the issue with our research is that it's always hard to get an ideal control group for any of our studies. Like, how can we do a sham clitoral hood surgery and just go, oh, see, the sham group improved just as much as the surgical group, therefore it's all psychological. Like, until we can do that, and I'm not suggesting that, research ethics don't come for me. But yeah, I think it's a challenge in the research area sometimes to disentangle that.
As we get towards the end of the hour here, Dr. Sharp, if you could talk to parents and say, you know, how would you advise them? And I'm not just talking, by the way, of parents of girls, but parents of young.
Yeah, parents of anyone.
As well. How do you tell them, without telling them they have to cut off all, you know, social media, which is unrealistic? How do you, although it would be nice, I will tell you that I think that social media is one of these things that has one of the greatest pluses and one of the greatest negatives in our society right now. What would you tell parents and young children themselves? When I say children,
oh, sure. And I was going to say, I spend way too much time on Twitter. I don't mind telling you both. I absolutely love social media. So, I am lucky enough to be able to speak with parents and young kids on a fairly regular basis. So I love this opportunity to say it on your wonderful podcast as well. And I honestly just say it's about having a dialogue from the very earliest point that your child asks questions about their genitalia and their body in general, because this is a chance for you to shape how they feel about themselves. Don't let social media and pornography be their first educators. You can be their first educators. And if you don't feel comfortable, then get a teacher, a coach, whoever to help you with this, or use some online tools. For spruiking my own TED talk, I do apologize, but it's you could use it to pardon me, to chat with younger people. So I think it's about having an ongoing conversation, and then that young person feels more comfortable to come to you during puberty when these body parts start to change more, or if, as we've mentioned before, if someone is maybe touching them inappropriately, wouldn't you want to know that? So it's absolutely about dialogue kids tend to start noticing their genitalia being different from others around 2 to 3 years old. So I know it's a lifelong conversation, but be their first educator, because you'll do it better than social media and pornography.
And Dr. Hamori, when somebody comes to you and says, I just want to look normal down there, what's your answer?
There is no normal. Everything's normal, those two. That's it's just a different variation in normal anatomy. I just tell them that, what's your normal? You know,
I think that's,
how do you define
that's
normal?
so true for all of us in the field of aesthetics, whether it's, you know, dermatology or estheticians or surgery or the psychology of aesthetics. There isn't a normal. There may be something that you desire, and one shouldn't be penalized to desire something, but
absolutely,
you have to have a realistic sense of expectation. And the fact that you're not, you know, what you see in a magazine doesn't mean that you're any less beautiful. But I can tell you that as much as I was looking for some disagreement here in this podcast, I think the fact that you guys are so unified on so much is actually very enlightening and very uplifting, because, you know, those great minds do tend to look at all aspects of procedures, the pros and cons, and put it together. And you both do that so excellently. Dr.
Thank
Sharp,
you.
I'm so glad to have met you. You're
Thank you.
Extremely informative and articulate, and I think helpful to so many people. And Dr. Hamori, you know, you have taught hundreds of your colleagues how to do this type of procedure better, how to analyze patients for this type of procedure, and how to make good choices. And you are a leader in your field, and one that I'm very, very happy to have had on this podcast today. So thank you both so much for being here.
Thank you. It's been brilliant.
Thank you. I look forward to talking to you both real soon. And for those of you who are listening, we have been with Dr. Gemma Sharp and Dr. Christine Hamori and talking about ways to look at the whole vulva region in a more different way, both from a psychological standpoint and from a physical standpoint. And hopefully you'll have gained a little bit more insight with this episode. Thank you all for joining us on Beauty and the BS, and we'll see you next time. The Beauty and the BS podcast executive producer is me, Dr. Peter Grossman. Our producers are Max Banta and John Largent, and editing and post-production services are provided by Game Day Media. You can listen to Beauty and the BS wherever you listen to your favorite podcast. And if you'd like to leave a comment or ask me a question, go to beautyandthebspodcast.com and click on the microphone icon, and we may use your comment on a future episode. You can also find our archives, video clips, and more on the website as well. Thanks for listening to Beauty and the BS with Dr. Peter Grossman.